Welcome to Module 6 of Regenerative Orthopedics for Arthritis. Today we master injection techniques and image guidance, the precision delivery systems that ensure your regenerative biologics reach their therapeutic targets. The most powerful biologic is useless if it doesn't reach the right location. Studies show landmark-based injections miss their target up to 40% of the time. Today, you'll learn to achieve 100% accuracy. By the end of this module, you'll master sterile preparation for biologics, ultrasound-guided visualization, joint-specific approaches, and special adaptations for viscous biologics and voltage-primed tissues. Section 1. The importance of precision delivery. Precision matters more than you might think. Intra-articular placement ensures biologics contact cartilage and synovium. Extra-articular injection wastes expensive product and may cause peri-articular inflammation. Proper injection creates even distribution across joint surfaces. Improper technique causes pooling, inadequate coverage, or extravasation. Think of painting. You need even coats for best results. Biologics injected outside the joint face rapid degradation. Proteases in periarticular tissues destroy growth factors within hours. The protected intra-articular environment preserves activity for days to weeks. Consider the economics. A single PDPA injection costs thousands of dollars. Missing the joint space wastes this investment. Precision delivery maximizes both clinical and economic outcomes. Data shows outcomes improve with operator experience. First 20 procedures, 60% success. After 50 procedures, 80%. After 100 with ultrasound guidance, over 95% success. Section 2. Sterile technique for biologic preservation. Biologics require meticulous sterile technique. Unlike pharmaceuticals, they contain no preservatives. Bacterial contamination can cause septic arthritis, a catastrophic complication. Begin with surgical hand hygiene. 3-minute scrub with chlorhexidine or iodine. Clean under nails with pick. Scrub to mid-forearm. Dry with sterile towel using blotting, not rubbing motion. Patient skin preparation follows specific protocol. Chlorhexidine alcohol or povidone iodine. Start at injection site, work outward in concentric circles. Never return to center with same swab. Allow complete drying, 30 seconds for alcohol, 2 minutes for iodine. Create a proper sterile field, sterile drape with fenestration over injection site. Sterile ultrasound probe cover, sterile gel. Never use non-sterile gel with biologics. All syringes and needles from sterile packaging. Handle biologics gently to preserve activity. Avoid excessive agitation which denatures proteins. Maintain room temperature. Cold reduces activity. Heat destroys factors. Use within 30 minutes of preparation. Master the no-touch technique. Once gloved, touch only sterile surfaces. If you must palpate, use sterile gauze barrier. Never touch needle shaft. Change gloves if contamination suspected. Cellular products demand extra care. Minimize syringe transfers. Each pass damages cells. Use large bore needles 18 to 21 gauge. Inject slowly to prevent shear stress. Never use needles smaller than 23 gauge. Section 3. Ultrasound Fundamentals for Orthopedic Injections. Understanding ultrasound physics improves image quality. Higher frequency, 10 to 15 MHz, provides better resolution but less penetration. Lower frequency, 5 to 8 MHz, penetrates deeper but with less detail. Choose probes strategically. Linear probes for superficial structures, knee, ankle, elbow. Curvilinear for deep structures, hip, obese patients. Hockey stick for small joints, fingers, toes. Master probe manipulation. Light pressure, excessive pressure distorts anatomy. Rock to optimize angle. Slide to survey area. Rotate for different planes. Fan to sweep through structure. Recognize common artifacts. Anisotropy makes tendons appear dark when not perpendicular to beam. Reverberation creates false echoes. Acoustic shadowing occurs beneath bone. Understanding prevents misinterpretation. Use Doppler to identify vessels. Color Doppler shows flow direction. Power Doppler is more sensitive for small vessels. Always check before needle insertion to avoid vascular puncture. Optimize every image. Adjust depth to center target. Set gain for balanced brightness. Position focal zone at target depth. These adjustments take seconds but dramatically improve visualization. Section 4. Needle visualization techniques. 2 fundamental approaches exist. In-plane aligns, needle parallel to probe, see entire shaft. Out-of-plane crosses perpendicular, see only cross-section. In-plane provides superior control for biologics. Mastering in-plane technique requires practice. Align needle exactly parallel to probe face. Maintain shallow angle, 30 to 45 degrees. Insert at probe edge, not center. Watch needle tip throughout advancement. Optimize needle visibility. Bevel up improves reflection. Jiggle needle gently to confirm location. Inject small amount of saline for hydrodissection. These tricks enhance visualization. The walk-down technique navigates difficult anatomy. Start steep, visualize tip. Gradually flatten angle while advancing. Maintains visualization while reaching deep targets. Hydrodissection creates space for biologics. Injects saline to separate tissue planes. Opens potential spaces. Confirms needle position. Creates reservoir for biologic distribution. Avoid common errors. Needle too steep. Flatten approach. Lost needle tip. Withdraw slightly. Realign. Poor visualization. Optimize image settings first. Rushing leads to mistakes. Section 5. Knee injection techniques. The knee offers multiple injection approaches. Understand sonographic anatomy. Suprapatellar pouch appears as dark fluid collection. Cartilage shows as smooth, hypoechoic layer. Menisci appear as triangular, hyperechoic structures. Superolateral approach is most common. Patient supine, knee flex 20 to 30 degrees. Probe longitudinal at superolateral patella. Visualize suprapatellar pouch. Enter 1 centimeter lateral to probe. Advance needle in plane toward pouch. Maintain 30-degree angle. Pass beneath quadriceps tendon. Enter pouch's widest portion. Confirm with aspiration or hydrodissection. Medial approach targets specific pathology. Useful for medial compartment disease. Probe at medial joint line. Advance needle between MCL and capsule. Allows compartment-specific treatment. Infrapatellar approaches exist but carry risks. Hoffa's fat pad bleeding. Difficult visualization. Higher infection risk, reserved for specific indications like fat pad treatment. Consider multi-compartment treatment. Inject suprapatellar pouch first, 40% volume, then medial compartment, 30%, lateral compartment, 20%, patellofemoral, 10%, comprehensive coverage for advanced disease. After injection, distribute product properly, cycle knee through flexion extension 5 times, helps biologics coat all surfaces, improves cartilage contact time, prevents pooling in recesses. Section 6, hip injection techniques. The hip presents unique challenges. Deep location requires careful planning. Proximity to neurovascular structures demands precision. Limited acoustic windows need strategic positioning. Anterior longitudinal approach is safest. Patient supine, hip neutral. Probe parallel to femoral neck. Identify femoral head-neck junction. Femoral vessels lateral. Avoid with Doppler. Insert needle at probe's lateral edge. Advance in plane toward head-neck junction. Feel resistance at capsule. Slight pop entering joint. Confirm with aspiration. Lateral approach useful for larger patients. Patient lateral decubitus. Probe over greater trochanter. Advance needle toward femoral neck. Longer path but avoids vessels. Hip accepts 5 to 7 milliliters comfortably. Excessive volume causes capsular distension. Monitor resistance during injection. Stop if excessive pressure. Suggest extra articular placement. Post-injection positioning matters. Maintain hip flexion 15 minutes. Allows biologic distribution. Reduces leakage through capsular puncture. Improves therapeutic contact time. Section 7. Shoulder injection approaches. The shoulder offers 2 primary approaches. Rotator interval anteriorly. Posterior glenohumeral approach. Each has specific advantages. Rotator interval approach is technically easier. Patient seated, arm at side. Probe transverse over coracoid. Identify interval between supraspinatus and subscapularis. Advance lateral to medial. Posterior approach provides direct access. Patient seated, arm across chest. Probe on posterior shoulder. Identify glenoid and humeral head. Advance medial to lateral. Don't forget subacromial space. Common site of impingement. Probe lateral. Visualize acromion. Advance needle beneath acromion. Useful for bursitis or impingement. AC joint injection requires precision. Small target, often osteophytic. Probe over AC joint. Use 25 gauge needle. Inject only 0.5 to 1 milliliter. Larger volumes rupture capsule. Section 8. Adaptations for viscous biologics. Viscous biologics present unique challenges. High resistance during injection. Risk of clogging needles. Potential cell damage from shear stress. Choose needles carefully. Minimum 21 gauge for PDPA. 18 gauge preferred for cellular products. Never use needles smaller than 23 gauge. Length depends on joint depth. Injection speed affects cell viability. Slow injection, 1 milliliter per 30 seconds. Reduces shear stress. Maintains cell integrity. Patience preserves potency. Two-needle technique facilitates delivery. First needle for joint entry. Second for injection. Prevents clogging. Maintains sterility, especially useful for PRF. Temperature affects viscosity. Warm products to room temperature. Cold increases viscosity and resistance. Never heat above body temperature. Denatures proteins. Monitor injection pressure constantly. Excessive resistance suggests needle tip against tissue. Reposition slightly. Never force. Risks needle breakage or tissue damage. Section 9. Voltage optimized injection protocols. Voltage optimized protocols enhance outcomes. Assess membrane potential pre-injection. Use bioimpedance or microcurrent device. Target negative 70 to 90 millivolts. Apply microcurrent 15 minutes pre-injection. 40 Hz frequency for joint preparation. 0.5 milliamp intensity normalizes cellular voltage. Optimizes receptor expression. The needle itself can deliver current. Special insulated needles with exposed tip. Deliver microcurrent during injection. Simultaneous voltage normalization and biologic delivery. Immediate post-injection PMF enhances integration. Apply directly over injection site. 8 to 15 Hz frequency. 15-minute session. Maintains voltage coherence during critical window. Proper grounding ensures effectiveness. Patient contact with grounding pad. Remove metal jewelry. Ensure dry skin contact. Poor grounding reduces therapeutic effect. Section 10. Troubleshooting and Complications. Every physician faces difficult injections. Obesity obscures landmarks. Osteophytes block access. Effusions alter anatomy. Solutions exist for each challenge. Obesity requires modifications. Use lower frequency probe. Consider curved probe for depth. Longer needles, 3.5 to 5 inches. Lateral approach often easier. Patience and persistence pay off. Osteophytes require creative approaches. Map accessible spaces with ultrasound. May need multiple injection sites. Consider CT guidance for severe deformity. Small volumes in multiple locations. Dry tap doesn't mean failure. Confirms needle in correct space. Absence of fluid is diagnostic. Proceed with injection. Some patients have minimal synovial fluid. Vasovagal reactions occur occasionally. Have patient lie down immediately. Elevate legs. Monitor vital signs. Most resolve within minutes. Always have resuscitation equipment available. Infection is rare but serious. Strict sterile technique prevents most. Red flags, increasing pain after 48 hours. Fever, erythema. Urgent aspiration if suspected. Culture and sensitivity guide treatment. Some discomfort is normal. Sharp pain suggests nerve contact, reposition. Burning suggests extra articular placement. Pressure sensation from volume is expected. Distinguish normal from concerning pain. Key takeaways. Let's consolidate your mastery of injection techniques. First, precision delivery directly correlates with clinical outcomes. Image guidance ensures biologics reach their target. Second, meticulous sterile technique is non-negotiable. Biologics lack preservatives. Contamination causes catastrophic complications. Third, ultrasound proficiency comes through deliberate practice. Start with simple joints, progress to complex. Fourth, adapt technique to biologic properties. Viscous products need larger needles. Cells require gentle handling. Fifth, integrating voltage optimization with injection protocols significantly enhances regenerative outcomes. Outstanding. You've mastered the technical skills essential for regenerative orthopedics. Precision delivery transforms good biologics into great outcomes. Next, in Module 7, we'll integrate everything, creating comprehensive stage-based treatment algorithms for your patients. Let's assess your technical proficiency with 5 questions. Question 1. What is the minimum needle gauge recommended for cellular products to prevent shear damage? Is it A, 25 gauge, B, 23 gauge, C, 21 gauge, or D, 18 gauge? Question 2. In-plane ultrasound guidance means the needle is oriented how relative to the probe? Is it A, perpendicular, B, parallel, C, 90 degrees, or D, random angle? Question 3. The super or lateral approach to the knee targets which anatomical space? Is it A, infrapatellar fat pad, B. suprapatellar pouch, C. posterior capsule, or D. medial gutter? Question 4. When injecting viscous biologics, what injection speed preserves cell viability? Is it A, as fast as possible, B, 1 milliliter per 5 seconds, C, 1 milliliter per 30 seconds, or D, speed doesn't matter? Question 5. Pre-injection microcurrent is applied at what frequency for optimal voltage normalization? Is it A, 8 Hz, B, 40 Hz, C, 124 Hz, or D, 528 Hz? Excellent work. You've completed Module 6 and gained crucial technical skills. Remember, your hands are the final instruments in the regenerative symphony. Master these techniques, and you master the ability to deliver healing precisely where it's needed. Every injection is an opportunity to restore health with precision and purpose.